Medical gaslighting is a term used to describe a situation where healthcare professionals unintentionally dismiss or downplay a patient's symptoms, making the patient feel invalidated or questioning their own experience. This issue has gained significant attention, especially among post-COVID patients who continue to suffer from lingering symptoms long after their initial infection. Post-COVID, also known as long COVID, includes a range of persistent symptoms such as fatigue, shortness of breath, and cognitive issues. In the wake of the COVID-19 pandemic, many patients have reported ongoing symptoms that can be debilitating and severely impact their quality of life. Unfortunately, not all healthcare providers are fully informed or equipped to handle these cases, leading to instances of medical gaslighting. It's important to understand that physicians do not intend to gaslight their patients. Rather, it often stems from an insufficient understanding of this new and complex illness. Take the case of Emily, a 32-year-old woman who contracted COVID-19 over a year ago. Despite recovering from the initial infection, Emily continues to experience severe fatigue, brain fog, and muscle pain. When she sought help, her doctors attributed her symptoms to stress and anxiety, rather than acknowledging the possibility of post-COVID complications. This left Emily feeling frustrated and unheard. Similarly, John, a 45-year-old teacher, has been dealing with persistent shortness of breath and heart palpitations since his COVID-19 recovery. Despite numerous visits to different specialists, he was repeatedly told that his symptoms were psychosomatic. John's experience is not unique. Many post-COVID patients face similar challenges in getting their symptoms taken seriously. Patients experiencing post-COVID symptoms may find their issues dismissed as anxiety or stress-related rather than being taken seriously. This can lead to a lack of proper treatment and support, exacerbating the patient's condition and causing further psychological distress. Medical gaslighting can erode trust in healthcare providers and discourage patients from seeking necessary medical attention. There are several reasons why medical gaslighting occurs. One reason is the novelty of COVID-19 and post-COVID conditions. The medical community is still learning about the virus and its long-term effects, which can lead to uncertainty and skepticism among healthcare providers. Additionally, symptoms of post-COVID are diverse and can overlap with other conditions, making diagnosis challenging. The impact of medical gaslighting on post-COVID patients is profound. It can lead to delays in receiving appropriate care, worsening of symptoms, and significant emotional and mental health challenges. Patients may feel isolated and unsupported, struggling to navigate their health issues without proper guidance. Consider Sarah, a mother of two who has been dealing with severe fatigue and dizziness since her COVID-19 recovery. Her doctors initially dismissed her symptoms as being related to her busy lifestyle, ignoring her pleas for thorough testing. It wasn't until she joined a support group for post-COVID patients that she found validation and eventually a specialist who took her symptoms seriously. It is crucial to raise awareness about medical gaslighting and advocate for better understanding and treatment of post-COVID. Healthcare providers need to stay informed about the latest research and be open to listening to their patients' experiences. Validating patients' symptoms and concerns is a vital step in providing effective care and support. Post-COVID appears to be a complex condition that may benefit from applying a biopsychosocial model for treatment. This model takes into account biological, psychological, and social factors, providing a more holistic approach to patient care. For example, addressing the biological aspects might involve managing physical symptoms through medication or physical therapy. The psychological aspect could include mental health support to help patients cope with anxiety or depression. Social factors such as providing support networks and community resources are also crucial for comprehensive care. Patients can also take steps to advocate for themselves. Keeping detailed records of symptoms, seeking second opinions, and connecting with support groups can help in managing their condition and finding the care they need. Empowering patients with information and support is key to combating medical gaslighting. For instance, David, a 50-year-old accountant, experienced a range of symptoms, including severe headaches, loss of taste and smell, and difficulty concentrating after his COVID-19 recovery. When his primary care physician suggested that these symptoms were likely psychological, David felt dismissed and helpless. After documenting his symptoms meticulously and presenting this evidence to a specialist, David was finally able to receive a diagnosis of post-COVID syndrome and began a treatment plan tailored to his needs. Medical professionals can play a significant role in combating medical gaslighting by staying current with research on post-COVID conditions and recognizing the legitimacy of patients' experiences. Community and support groups can also provide valuable resources for post-COVID patients. These groups offer a platform for individuals to share their experiences, find validation, and receive advice on navigating the healthcare system. Connecting with others who are facing similar challenges can provide emotional support and practical tips for managing symptoms. For instance, a post-COVID support group helped Robert, a 54-year-old construction worker, find a specialist who was familiar with his symptoms. Robert had been experiencing persistent respiratory issues and extreme fatigue, which were initially attributed to his age and job stress. The support group provided him with information about specialists and treatment options, leading to a proper diagnosis and management plan. Raising public awareness about post-COVID and the potential for medical gaslighting is essential. Educational campaigns can inform the public about the reality of post-COVID symptoms and the importance of taking them seriously. This can help reduce stigma and encourage more supportive attitudes towards those experiencing ongoing health issues. The media plays a crucial role in shaping public perception and can help bring attention to the challenges faced by post-COVID patients. Highlighting personal stories and expert insights can foster a more understanding and empathetic environment for those affected. For example, a news segment featuring the story of Jessica, a 42-year-old artist, shed light on the struggles of post-COVID patients. Jessica had been experiencing debilitating fatigue and neurological symptoms, but her condition was often dismissed as psychological. The media coverage not only raised awareness about post-COVID, but also connected her with a community of others facing similar challenges, providing her with much-needed support and resources. Policymakers and healthcare organizations should also prioritize research and funding for post-COVID conditions. Investing in research can lead to a better understanding of the long-term effects of COVID-19 and the development of effective treatments, ensuring that healthcare systems are equipped to handle The influx of post-COVID patients is crucial for providing adequate care. In summary, medical gaslighting is a serious issue affecting many post-COVID patients. By raising awareness and promoting better communication and understanding between patients and healthcare providers, we can work towards ensuring that all patients receive the respect and care they deserve. It is essential to acknowledge and validate the experiences of those suffering from post-COVID to improve their treatment outcomes and overall well-being. Patients can take proactive steps to advocate for themselves, such as keeping detailed symptom records, seeking second opinions, and connecting with support groups. Empowering patients with information and support is key to combating medical gaslighting. Healthcare providers must stay informed about post-COVID conditions and adopt a patient-centered approach, actively listening to and validating their patients' experiences. Training and continued education on emerging health issues can equip healthcare providers with the knowledge and empathy needed to support their patients effectively. Community and support groups provide valuable resources for post-COVID patients, offering emotional support and practical tips for managing symptoms. Public awareness campaigns can help reduce stigma and encourage more supportive attitudes towards those experiencing ongoing health issues. The media plays a crucial role in shaping public perception and can help bring attention to the challenges faced by post-COVID patients. Policymakers and healthcare organizations should prioritize research and funding for post-COVID conditions to ensure that healthcare systems are equipped to provide adequate care. By addressing medical gaslighting and supporting post-COVID patients, we can foster a more understanding and empathetic healthcare environment. It is essential to acknowledge and validate the experiences of those suffering from post-COVID to improve their treatment outcomes and overall well-being. Thank you for watching our video. If you found this information helpful, please like, share, and subscribe to our channel for more content on important health topics. Remember, your health matters and your experiences are valid.